Well, hello, and welcome to Facebook Live with Dr. Brie. What do we know about brain health? So, today's a very special Facebook Live for me. First and foremost, I'm Dr. Brie Seefeld out of Colorado, and I have been a practicing integrative medicine and direct primary care physician here for the past 7 years in my own practice, but in practice for about 14. And this is my first Facebook Live after a big car accident I had last year. So we're talking about brain health. How cool is that? And I'm real familiar with mine now, which is lovely. So here's the thing. About this time last year, before the car accident, I was thinking about brain health and what I had learned in med school. And I realized that I didn't know as much as I felt like I wanted to know. I felt like here we are in med school, and we're taught about preventing heart disease, great. Detecting for cancer and screening for cancer, excellent. With the brain, we're taught, well, they might get MS or Alzheimer's or dementia or a brain tumor. Those are all bad, what I like to call the big baddies. But outside of that, there's kind of nothing we can do. Like, I feel like a little bit, that's what I learned. So I was listening to the book by Dr. Daniel Amen, You Happier, and I was reflecting on this concept of what I like to call preserve all the neurons, right? How do we preserve the neurons? How do we apply functional integrative medicine, holistic health, things I've studied for years and years, to brain health? How do we do that? And why didn't we learn how to do that in school? That's a story for a different day. One of the reasons we didn't learn is because we didn't know a lot about how to really evaluate brain health before it was gone. You know, once the brain has damage enough in a traumatic injury or in a, complex medical problem like the ones I mentioned and the big baddies, then we know, ooh, yeah, that brain's not doing so good. And it's more or less obvious, right, that it's not doing good. But how do we prevent getting there? So that's where I was at right before I received my own concussion and had to really understand, how do I fight back from that? And how do I get my brain back to a place of balance and in getting really familiar with these preventative strategies? So I learned a few things and I applied them to the things I knew before. Now we have our brain health assessment program at Direct Osteopathic, which I'm super excited to share with our clients. So here's how it works. We are using a couple of different tests from all throughout my career that are now applied in a 360 view of what's going on with your brain health. So I'm going to explain them. The first one is neurotransmitter testing. I've done neurotransmitter testing through ZRT Labs since 2016. And at the time I started looking into it, I was working with an integrative psychiatrist. He's a really nice doctor who's retired in Denver. And I said, what do you think about neurotransmitter testing? He's like, I think it has some legs. But the challenge is when you get a dried urine specimen, which is what it is, and it looks at the metabolites and the fundamental building blocks of, let's say, your serotonin system, right? What we don't know is if you have enough serotonin in the parts of your brain where it really needs to be working right. So people who say neurotransmitter testing is all bunk, well, that's their argument, right? As we can't tell if it's active in the brain where it should be at the time you need it, right? But you can also say if your total body serotonin fundamental building blocks, tryptophan, serotonin itself, and metabolite, 5-HIAA, are all low, well, then we can kind of make the assumption that your brain might not have enough, right? And that might lead to symptoms of, say, anxiety, right? Because serotonin's our feel-good hormone. It's one of our calmer downers. And so it helps us to feel like, it's okay, everything's okay. So if we don't have enough of that in our total body serotonin output that you can see in this, dried urine specimen, well, then we can make certain clinical assumptions about that when we combine them with traditional, screening tests for depression and anxiety symptoms, right? So neurotransmitter testing has been really helpful for me over the past several years in understanding, for example, something like depression. When we looked at standard Western medical ways of approaching depression, which, as a primary care doctor is kind of what we call bread and butter thing for us, right? Not, really severe hospitalized depression often, but run-of-the-mill post-COVID era depression every day, right? See patients who are struggling with this all the time. And what I realized with neurotransmitter testing is that there's a big difference in a serotonin deficiency depressant, right? Which is like, I don't have the calmer downers in my brain to calm down, versus I have so much excitatory neurotransmitters, I don't know what to do with it, so it makes me feel down and depressed, right? Like there's too much excess, too much foot on the gas, versus not enough foot on the brake, right? So that's what neurotransmitter testing tells us. It tells us our excitatory neurotransmitters, your uppers, if you will, and your inhibitory neurotransmitters, which are your calmer downers. And it tells us what is the balance there, and we combine that with symptom screening, history, and we can come up with personalized recommendations for how to balance that out and what might explain how you're feeling. The other thing that's great about neurotransmitter testing is the direct look at epinephrine, norepinephrine, which are your run from the bear hormones, your catecholamines, your fight or flight or freeze hormones. So you can see that directly in those results. So that's a helpful test. I love it. It's been great. I've used it for a long time. And then I encountered quantitative EEG, and I totally fell in love. I'm like, this is even better. Who knew that there could be different biomarkers for the brain that we could use to apply to our understanding of the fingerprint behind the symptoms? So stay with me here. Quantitative EEG has been around for a long, long time, okay? Well, EEG has been around since the 1930s. In the 1990s, with the advent of computer technology, the ability to analyze lots of data, they were able to quantitate the EEG recording. So what is an EEG? Okay, you've had an EKG maybe. An EKG is an electrocardiogram, right? It's looking at or ECG, we'll call them sometimes as well. It's the electrical activity of your heart and produces a tracing and a rhythm, and the doctor says, oh, you're having a heart attack, or oh, your heart looks okay, or oh, maybe you have an arrhythmia, right? So that's what the electrical output recording is for the heart. Well, our brain has electrical output, and it has a recording as well. And that's called an electroencephalogram, also known as EEG, much easier. And that's where we, in the past, people in medical training, I'm like, yeah, of course, we look at seizures that way, right? But what happened was there were folks in the 1990s, Mark Neuer, who was able to characterize and quantitate EEG against normative measures. So they were able to say, this is what we expect from a normal brain or normal parameters, which, you know, is an interesting journey, but really it was a statistical analysis that they were able to get a reference point that allowed for, you know, evaluations of deviations from that reference point. And they were able to look at the waveforms that our brain puts out, alpha waves, beta waves, theta waves, delta waves. Sometimes this rings like a little bell, like, well, I think I've heard about something like that, right? And those waves, they were able to connect to certain behavioral patterns, right? So since the 1990s, the American Academy of Neurology, the American Academy of, the American Clinical Neurophysiology Society, these are organizations who are able to say, you know what, this is actually a useful tool. Now, is it commonly accepted? Not yet. Will it be? Yes. Because it is such a great non-invasive technology to help us get biomarkers for the fingerprint of the brain behind symptoms. What does that mean? So let's take a word like anxiety, okay? So when somebody says to me, Dr. Brie, I have anxiety, right? I have my own set of assumptions about what that feels like, what that acts like, what that means for that person. What you may describe as anxiety may be what somebody else describes as depression, which may be what somebody else describes as a term like, I feel all over the place today, right? So when we take that symptom and we take symptoms-based approaches, even though they're evidence-based and normed for what people should say, and this is depression, this is anxiety, and here's the questions we can ask you to drill down on symptoms, it's still symptom-driven, right? And that's the whole field of psychiatry and psychology, and it's great. There's a lot of good clinical information, a lot of good clinical expertise that comes out of that. However, what we don't have is a biomarker or a reference point to compare that to, right? So that's where quantitative EEG comes in. I'm going to make it super simple because I'm a family doctor and I know a little bit about a lot of things, but I don't know everything about anything, and I'm okay with that. So I like to make things really simple, okay? So let's just pretend that these waves are alpha highest frequency, beta next, theta slower frequency, delta asleep, okay? Okay, alpha high frequency, theta sleepy, okay? Just before sleep, which is delta. So one person says, I have anxiety, and that person has a lot of alpha and beta, okay? And that person's brain is in a high frequency fast brain. So their brain's like always thinking and always going, and they lay down at night and they're like thinking and going through their day and they're ruminating and they're like, oh God, I forgot to do that. They wake up 3 o'clock in the morning and they're like, oh, the laundry list, the laundry list. That is an anxiety that has a fingerprint of alpha and beta. Okay, so that is a high frequency fingerprint. So what do we do about that? We use calmer downers, right? We use meditation, we use mindfulness, we need breathing, we can use supplements and medications that calm down that high frequency. And so we can treat the fingerprint and then the symptoms get better, right? So we have person B, and person B has anxiety. Dr. Brie, I have anxiety. And Dr. Brie evaluates this person, and the fingerprint behind this brain on quantitative EEG is a theta brain, a brain that's sleepy. So what does that look like? ADD brains, attention deficit disorder and attention deficit disorder and hyperactivity brains, there's a lot of different kinds. Once you start parsing out the quantitative EEG, you realize there's more than just 2 types of ADD, but one type is the all over the place, scattered, can't dot the I, can't cross the T, this cupboard's open, that sentence is unfinished, this project's in disrepair, and that creates this scattered all over the place feeling of anxiety that's actually ADD. ADD is a theta predominant pattern, that's the fingerprint, and so the treatment is stimulants and waking up, exercise, cardio, right? Getting outside, being in the wind and the sun, and also sometimes stimulant medications and stimulant supplements. So when we look at the fingerprint behind the brain, we understand in a totally new way how to treat it. And we can put that together with the same traditional standard of care, questionnaires, evaluations, clinical expertise, to really understand this 360 view of what's going on, the root, right, behind the symptoms. We've never had that for mental health before. That's why I'm on Facebook Live again to tell you about it, because I'm obviously very excited about it. So then I thought to myself, I really like these brain maps. They're really fun. That's quantitative EEG, much easier thing to say, brain map. So I'm going to bring it in-house to Direct Osteopathic so we can use it so it's at our fingertips and then we can understand what's going on. But what if we combined it with neurotransmitter testing? What if we had one level 1 brain health assessment, which is neurotransmitter testing alone, and level 2, which is brain map alone, level 3, combine them, and then the creme de la creme, level 4, my favorite personally, is neurotransmitter testing, quantitative EEG brain map, and hormone testing. Why? Because I have to say, in the last several years, one of the things I hear a lot from our folks, many women, also men, in transitional points in their hormone journey, andropause, menopause, I don't know, Dr. Brie, but I just don't feel like myself anymore. I have new XYZ symptoms, and I have this brain fog, I have these gaps, I'm not sure if I'm losing it, I'm not sure if I'm really stressed, I'm not sure if it's from not sleeping, I don't know if I just haven't recovered from the last several years, but I just don't feel like myself, something's off, and I don't know what it is. Brain health level 4, 360 view, what is it? So we can dive into those inflection points because all of these systems are interrelated and they all impact how you feel. And we really want to get to the root cause of what is going on there and help you to feel better. So that's our brain health assessment program, and I'm super excited. And I get to apply the true prevention because it turns out there are things that you can do to prevent problems and to optimize your neurons and to be in your own preserve all the neurons campaign. There are supplements, there are medications, there are lifestyle changes. The takeaway is anything that's good for your heart is good for your brain. So I mentioned it a few times, but exercise, fruit, vegetables, and guess what? Number 1, sleep. All right, folks. I'll see you in the clinic. Let me know if you're interested. We are now doing our brain health assessment programs at this month at a discount between February and March. So if you're a member of our clinic, you can reach out to us in the portal and get yourself scheduled and get all the details on our programs. If you're not a member of our clinic, you can look for that information soon on our website. It's undergoing some remodeling and it will be out there soon, and hopefully we'll get to apply this to you and help your neurons along the way to be as healthy as they can be. Have a great day.